everyone. So today we are talking about PCOS, PMOS, PCOD and much more. We have with us Jeanne Ribeiro, the head nutritionist at Nutritionist, who will be throwing light on this newly discovered metabolic disorder, PMOS. Welcome to 404 Not Planned, Jeanne. So when we talk about PMOS, is it just the name changed from PCOD to PMOS, or has the line of treatment also changed?
That is something I'm hoping for, because I'm first of all very glad that this conversation has even opened up with everyone, the doctors and the medical profession, because once now that we know it is not an ovarian issue, we now know that it is a hormonal issue. We know that it is insulin dependent, it is androgens, it depends on the androgens and not just the ovaries. So we need to start treating it on all these terms. We need to work in terms of reducing the insulin levels. We need to have doctors know, nutritionists know that it is not just the ovaries you're supposed to be looking at. A lot of us in the past, the medical profession was chasing ultrasounds. If there was a cyst in the ovary, you had PCOS. It's not about that, because ultimately if you don't have cysts in the ovaries, you could still have PMOS. Okay. Because of the insulin resistance, because of the facial hair, which is the androgen, the hair fall, which is androgen. There are a couple of ways you diagnose PMOS. It's basically if you have irregular cycles, if you have any of these androgens being high, whether it is your testosterone, which causes the facial hair, or the DHT, which causes the hair loss, or if you have insulin resistance, which means that your insulin levels go up, your sugars tend to go up after some time. There are a lot of people who have normal blood sugars but high fasting insulin. That also needs to be checked, because a lot of patients don't get a chance to test this because the doctors say, no, your sugars are normal, you don't need to check fasting insulin. But we definitely need to check fasting insulin, because that also has the right range. Anything between 4 to 8 is optimal. Anything above 8, you know that it's starting to rise. But anything, it needs attention. And anything above 24, the doctors will be like, hey, you need medications. But why wait till it reaches 24 or 25 or 30? You need to act, even if it is 12, even if it is 15.
Start early.
Start early so that we work on the androgens, we work on everything else before you end up having irregular periods. Now, there are also a couple of myths that come up with this. There is the myth that a woman with PMOS may not be able to conceive. We said yes, they can conceive. But there is also the other myth that conception is the only issue with PMOS. But that's not the issue, because a lot of women trying to conceive also end up having miscarriages. For example, I had a client who had 2 miscarriages prior to coming to us, and they were going in again for an IVF cycle or an IUI cycle. Point being that her insulin was high, her androgens were elevated. When we worked on all of this, plus her gut, we started with her gut and then went on to working on the insulin and the androgens. Once we brought all of this into control, within a 1.5 months, I think it was, she got pregnant. Now remember, getting pregnant was not her issue. Staying pregnant was the main issue. So we worked in terms of seeing that her insulin levels were much under control. We had to see that, because when you have insulin prior to pregnancy, there is a tendency for you to get gestational diabetes during pregnancy. So you want to work towards controlling that so that your baby doesn't get affected. So we worked to see that that was under control, so that she doesn't have the miscarriage because of all this inflammation in the body. So this is how, you have to work on multiple issues, not just for conception, not just for staying pregnant, but feeling good yourself as a woman.
So we had a wonderful conversation with you.
Yes.
I hope our audiences have taken back a lot of information, and they don't leave PMOS unmanaged, untreated, just thinking it to be like a normal disorder. It will take care of itself. And we appeal to the audience to go for nutritional guidance before taking any further steps and leaving PMOS unmanaged. When we talk about this, we've heard that women with PMOS cannot conceive naturally. People who have these issues cannot conceive naturally. How true is that?
That's actually very untrue, because the main issue here is, yes, if a woman has PMOS, ovulation is hampered and conception may not be possible, or rather ovulation may not happen every month. It may be every other month that ovulation may happen, and then of course depending on when you ovulate, the conception may happen. But if you don't ovulate, conception obviously won't happen. What happens here is if their insulin levels are elevated and the androgens are elevated, it doesn't allow the follicles to get released and matured very well. When this does not happen, it is not available for conception. Your egg is not available for conception because you have not ovulated. This also works a lot with our clients, because we've seen clients when the doctors end up giving them letrozole, which is to stimulate the follicles.
Okay.
They don't end up, the follicles don't get released with letrozole because we have not worked on the root cause, which is working to improve the androgens, which has stopped the ovulation. We need to bring down the insulin, we need to bring down the androgens so that the ovulation happens. Then your letrozole will have its effect, if at all.
So I think from what all we've heard, medication is not the right thing that women should opt for if they are undergoing PMOS. I think lifestyle changes would help them better. So beyond fertility, we've always heard about fertility. What are the long-term causes, long-term effects that women with PMOS suffer from?
So when it comes to long-term effects, one is that of course there are irregular cycles. Like we've discussed, if you have PMOS, it's a hormonal, endocrine, metabolic issue, and we know insulin resistance goes up, we know androgens go up. When this happens, ovulation gets hampered. You are not getting your cycles on a regular basis, which is technically supposed to be every month. You're supposed to have that, you're supposed to get your periods, post your periods, you're supposed to feel so energetic, you're supposed to have that, your libido is supposed to be up, your mental health is supposed to be great. But when none of this is happening, when you don't get your periods, everything is going up and down. You feel very lethargic, you have fatigue, you have hair fall, you have facial hair, you have acne. The woman is going through a lot. By default, this then continues. Imagine if your hair fall is not treated because of the high testosterone or the high DHT, that's leading to a lot of, you're not comfortable with how you look if you have hair fall. You're not comfortable with the facial hair. You have, if the insulin resistance is not improved, that can eventually lead to diabetes very early on in our young girls and women. And there is also a lot to do with the inflammation that comes up. And when the inflammation comes up, it leads to a lot of cardiovascular issues, which means your cholesterol levels go up, lipids go up. It is very easy to bring down these lipid levels if you're working on your insulin, if you're working on your androgen levels, because this is the inflammation that is triggering the lipids to go up. So you have multiple concerns that happen, plus your mood gets affected long term, and we know how we feel when we are completely low. We know how we feel when we have PMS, which is like a week prior, 10 days prior, few days prior to the periods. We know how we feel. Imagine feeling that continuously during your month because you've not got your periods. So by default, these are a lot of issues that can come up, and it is so easily treatable if you just work on your lifestyle, you work on your sleep, your stress, your hormones, and ultimately your gut. Because technically gut would be the first step through all of it, but once all of this gets improved, it's like a very easy process for the woman to feel much better. We've helped a lot of clients improve and get into remission. I wouldn't say reversible, I would call it remission, because it is very easy for you to get the issues back. So you need to work to see that these levels are under control, because your body has a tendency for PMOS. By keeping them under control, you're bringing it into remission. Conception is easy, you feeling very well is good, your hair fall, your hair growth gets better, your periods start getting regular, mood starts getting better.
So as a nutritionist, if there was one thing that you could change for these females, or maybe their families or the caregivers, what would that one thing be?
In that sense, it would be working on the insulin levels for sure. There is a supplement called inositol that we have. Plus, and when I speak of inositol, I'm talking about the right combination that is needed. Myo-inositol and D-chiro-inositol at a 2000 mg and 50 mg of the D-chiro. This combination is very helpful for someone with high insulin levels. But apart from that, you just can't take that and not work on your lifestyle. You have to be working on the food aspect. Now, when it comes to the food aspect, it has to be a combination of the right amount of carbs, the right amount of proteins, the right amount of fats, and fiber, of course, because all of this as a combination will help you bring down your insulin levels. That being said, work on the gut. Try to reduce any inflammation that your gut may be going through. Look out for signs like bloating, gassiness, acidity. These are signs that something is not suiting your gut and it is triggering your gut to get inflamed. When that happens, obviously, like I had mentioned earlier, this is leading to a lot of that inflammation getting into the bloodstream, causing your insulin levels to rise. That also needs to be tackled. Apart from this, working on the androgen levels. In terms of androgens, we need to also see inositol helps with improving the androgens. Including zinc-rich foods also helps with improving the androgens, whether it is maybe including pumpkin seeds or maybe a zinc supplement, but that is if you have your doctor or your nutritionist recommendation. Because then we need to know how much to take and how long to take it for.
Okay.
Yeah. So once they stop the pills, there is something called as the post-pill awakening issue, which means that your body has not been producing the hormones all this while. It's going to come roaring back in a way with so much of vengeance, because your body is now, there's nothing to protect your androgens. Your insulin has gone so high, your androgens have gone so high. We have not worked on that. We have only worked on dampening it all. Symptoms are under control, but your periods have been irregular before you started the pill. Now, because you were taking the pill, it was like a 24-day cycle. No bleeding, and then 7-day bleeding. Now, when you stop that, your body is going to get so confused because you had such high hormones in your body that now there is nothing. How do I produce the hormones back again? Plus, then you have the androgens which are high, you have the insulin levels which are high. So all of this will come with more. You'll have probably more acne. You'll probably have more facial hair. There will be the hair fall that starts happening. Plus, your periods won't be regular. And when this happens, there is also something called as a post-birth control syndrome, which means that all this that I spoke about, we need to work on the deficiencies that come about with all these pills. There is B complex deficiencies. All the B vitamins gets depleted. You have magnesium deficiency that happens. So we need to start bringing this back into the picture in different ways, whether it is through food or whether it is through supplements, but we need to start substituting back in our body. Plus, we need to go through the process of improving the androgens, improving the insulin resistance, so that we are treating the root cause and helping you get to the ovulation again.
Okay, naturally.
Naturally.
So there is always a myth that women with PCOD, PMOS, they cannot conceive naturally. They have fertility issues. How true is that?
That's a big myth, actually, because a lot of women with PMOS, as long as we are helping them improve ovulation, ultimately, if they don't ovulate with PMOS, they will not conceive. But if the insulin is brought under control, if your androgens are brought under control, you start to see that the ovulation starts happening, your follicle and the egg is ready for conception.
Okay.
So that way, it's a myth that needs to be broken a lot of times.
There's always been a myth that overweight women only face PCOD, PCOS, and now PMOS.
Yeah.
So would you say, is this a myth or a fact? How would you clarify this?
It's a very damaging myth, actually, that only overweight women have PCOS, because there are so many women who are lean and have PMOS. And the term also comes down to the advice that a lot of doctors give. Drop weight, lose the weight. That's not the right advice, because ultimately it's not the weight, or rather, even if someone is lean, they are not going to lose weight. You need to focus on what is driving the PMOS. The drivers are basically your insulin resistance the testosterone and the androgens going high, and of course the lifestyle, which is driving both these two together. So a lot, we can say almost there are 83% of women in India who have the normal BMI. So you are talking about normal weight-height ratio, but they have PMOS.
We've also seen a huge rise in PMOS amongst young girls, teenagers. So what advice would you give to parents or caregivers of these teenagers? What should be their attention? So what do you think are the lifestyle factors that are affecting the increase of PMOS these days?
It starts with your body stopping responding to insulin, a hormone. Now, if insulin is like your body is not responding to insulin, it sends a signal to the pancreas. Pancreas gets the information that there is not enough insulin, so the pancreas sends more insulin into the bloodstream. That's basically your body trying to take care of all the food you're eating. And once the insulin goes up, that signal goes to the ovaries that to increase testosterone, which is the male hormone. Now, all of us need a certain amount of male hormone in the body. But for females, it should not go too high because we need the female hormones more than the male hormones. So when that happens, the testosterone goes up, it sends a signal to the liver to stop eliminating testosterone. By default, testosterone is supposed to get eliminated normally by the liver. That stops happening, and then there is a signal that goes to the ovaries to stop ovulation. Now we know that there are follicles which then mature, which get released, and then you have ovulation.
The entire process gets delayed.
Yes, so then the overall process gets stopped completely. Ovulation does not happen, and that's how they thought that the ovary was the source, which actually it's not. It's the endocrine, meaning hormones, metabolic, meaning lifestyle. And when I say lifestyle, I'm talking about maybe it could be the stress, like when you have too much stress or there is lack of sleep, your cortisol tends to rise. When cortisol goes up, it sends a signal to insulin, produce more of the insulin. By default, if insulin rises, again the cycle repeats. Then you have the other factor of if you don't do a workout. Technically, strength training is much better than a cardio type of a workout for a PMOS type of a situation. Apart from this, you have the gut. If there is any form of gut inflammation, if you're eating any food that maybe you don't tolerate, or in some way you have continued to eat a lot of food that is causing inflammation, that gets leaked out via the leaky gut situation into the bloodstream. Again, giving a signal to the insulin to go up. So if you see, it's not an ovary syndrome. Ovary is like one part of the whole thing. It's like the hormones and the metabolic issue.